Welcome back to Morning Express, and well, it's time for your health. Every Wednesday around about this time we look at your health, and today, well, we have an interesting subject, especially for many of us who would like to know. I've read it in different areas, and there are those who feel that shisha smoking is not a health hazard. Let me see, there are some who are already saying yes, any smoke that goes through your lungs. There's also somebody who says shisha smoking is very healthy because it's purely flavored steam. Okay, so there's different angles and there are different ways that we look at that, and that's what we'd like to look at this morning. And to have that conversation, joining me this morning, we have Dr. Gladwell Carrier, who is a medical oncologist and also a senior lecturer at University of Nairobi. Thank you for joining us.
Thank you very much.
And good morning.
Good morning.
All right, we also have Mr. Frederick Asije, who is a manager at the Cancer Treatment Center. Good morning, and thank you for joining us too.
Good morning to you all. Thank you for calling us to the studio.
Maybe let's start with elephant in the room, as it were, and by trying maybe to demystify, and I'll start with you, Mr. Frederick Asije, as to whether it is safe to smoke shisha. It's a very popular thing right now for amongst the youth, especially when they go out, when they go out. Mainly it's something that is part of the entertainment, and of course there has been a notion that possibly it is safe. It's not tobacco.
Yeah, shisha, to say anything that we say garbage in, garbage out. Yeah. So you'll find most people like tobacco, which, shisha has a lot of substance that is also included in it. And you'll find that majority of people, once you take and the body tends to respond, the effect will be long-term. And for continuous use of this shisha will have an implication on your health, definitely.
Okay, yeah. So you would say it is unhealthy?
It is unhealthy.
Okay. Yeah. Daktari, maybe your comments on shisha smoking?
Yes, now the problem is that the shisha has multiple agents in it. And one of the worrying things is sometimes the constitution includes drugs like bhang, which are thought to be, social drugs. But the chemicals in the shisha, with continuous and regular use, sometimes can act as corrosive and irritant substances to the mucosal membrane in the mouth. And that causes some inflammation, which leads to dysregulation of some of the multiplication of cells, and they can turn abnormal or dysplastic and become malignant, and hence pose a risk as cancer, especially to the oral cavity. So it's probably not as safe as people would like to think, and probably its regular use should not be encouraged.
Should not be encouraged. All right, Frederick, maybe looking at tobacco and shisha in terms of comparison, is there one that you'd say is worse than the other? I mean, ultimately, we're saying it is not healthy. But in terms, if you put them on a weighing scale, would it be safer to smoke shisha than to smoke tobacco?
Contrary to the public belief, shisha, it depends. Others, it depends who produces the shisha. You will find others who will have additional additives to make it so that the customer will prefer, preferably by the customer. Then definitely it depends those substances that someone has already added onto it. But tobacco, it has already been controlled. It has a control from the manufacturers. You know what substances that they have added to it. But I would say tobacco use, actually, it has a more effect as compared to shisha.
As compared to shisha.
But also it depends where the shisha has been produced and what
and what ingredients they put there, because I guess whoever is preparing the shisha really sometimes, depending on what they want to give you as an experience, you may not be aware what concoction they've used.
Yes, exactly.
And like you've said, mainly tobacco at least is controlled by the various bodies that ensure that you're getting whatever it is that you get. Dr. Carrier, possibly looking, it has been said consistently that we do not know the cause of cancer. However, tobacco smoking has been largely associated with cancer. Has that changed Do we know what the cause is?
That has not changed, Mr. Gitonga. We know that tobacco use, either chewed or inhaled, and cigarette smoking is one of the direct carcinogens known to man. And cigarette smoking and tobacco use is associated with around 43 different cancers. And what we think is, and what has been written time and time again in papers, is that a human being may be born with a genetic susceptibility to cancer, and then an environmental trigger triggers the process of carcinogen and development of a malignancy. And this will depend on what the body's susceptibility is. It may be a bladder cancer, it may be a lung cancer, it may be oral cavity malignancies. But tobacco use and cigarette smoking is unknown, one of the established direct carcinogens, and that has not changed.
Okay. Frederick, you are the manager of a cancer treatment center. There is generally an increase in cancer cases in the country.
Yes.
Do we know what we attribute that to? I don't know if we have more people smoking. Do we have more people maybe using things that would make us more susceptible to cancer?
Yeah, there are quite a number of effects associated with the increase. And mostly we can say also we have the lifestyle changes. Yeah, we have now currently there's increased pollution into the environmental. You know, there's that environmental aspect of our country at the moment. And also we have quite increased awareness of most diagnostic services have increased in both counties and also in the national hospitals. So there's that increased awareness, and also we can say those trigger factors are associated with the environmental effects. And most, you can see, as opposed to the previous years, today, you'll find quite a number of, a huge population of youth have also engaged in early smoking and also use of alcohol. Yeah.
All right, Dr. Gladwell, let's talk about maybe throat and mouth cancer, because I think they are also on the increase. Is there a direct link to possibly smoking?
Definitely, yes. Definitely, there is an association with smoking. And other than smoking, chewing of tobacco has also been associated with oral cavity cancers. In our cancer registry, oral cavity cancers, or what we called head and neck cancers, were very high in the registry. But what had happened is that all cancers of the head and neck were lumped together. But they are multifactorial, so you can separate them a little bit, because some of them were metastatic, coming from one place and going to the oral cavity, but still lumped as a head and neck cancer. So definitely tobacco has something to do with it. What Fred has said, the increase in numbers of malignancies we see generally in oral cavity cancers as well is because of lifestyle changes, as well as what we call a measurement bias. If you have more diagnostic facilities and you can be able to diagnose something more, then the numbers look as if they are higher because you are actually picking them up and actually recording them. They may have existed before, but they were not measured, they were not diagnosed, and therefore we thought the numbers are lower. And also an increased awareness. There are more people speaking about cancer, and therefore creating this awareness that it exists among us, everybody is at risk, and therefore creating a sort of awareness that cancer numbers have actually increased. People talk about their brothers, their sisters, their relatives with cancer more than they did in the past.
Okay, so there's that general awareness.
Yes, about the disease, a general increase in making the diagnosis. We have, biopsy facilities, we have x-rays, we have CT scans, we have endoscopy facilities more than we did in the past.
Okay.
And of course, the issue of lifestyle. There are more people smoking now than probably they did in the 1970s. There are more women smoking now. The age of smoking has probably come down, and therefore a longer exposure time, therefore an environmental, trigger to develop malignancies. Now, oral cancers, like we see head and neck cancers and oral cavity tumors are very common in the Asian subcontinent, in India, Pakistan, and so on, because of corrosive and irritants in diet, they chew tobacco and probably, you know, take hot substances with a lot of chili and a lot of, you know, elements that are added to food that are associated with this oral cavity primary tumors. So probably as our diets change and we take up more Western and, you know, copy some of the international diets, then our risk also increases. Towards this oral
You've mentioned
cavity
something
tumors.
important there,
Yes.
and you've talked about hot things that they take, especially in the Asian countries. Are you suggesting that maybe those hot things could make us more susceptible to cancer?
Yes, it has been hypothesized because, you know, whenever we see that there is a high risk in a certain population, we look at epidemiological factors like diet and their lifestyles that may predispose them to that. And one thing we know about the Asian subcontinent diets is increased chili, a lot of spices, and, you know, even hot, you know, liquids that are used. And, you know, we are copying more of that. You know, we are leaving some of our traditional, you know, foods that we had and copying a lot more of these international diets. And that, of course, puts us at a risk, you know, as they would, you know, in the places where some of these diets come from. And the tobacco use, the cigarette smoking cannot be underemphasized because definitely that has contributed to the increased numbers of oral cavity tumors as well as our lung cancers.
Okay, and just to clarify, when you say hot, you mean hot pili-pili or hot temperature?
Both.
Both
actually,
of them?
Yes.
Okay.
Because what happens, the association with cancer is creation of inflammation. And in fact, for example, the high numbers of some of the esophageal cancers we see, like in Western Kenya and in the Rift Valley, is associated with consumption of nitrosamines in diet, in smoked fish, and certain preparation of foods. And likewise, you know, some of the irritants, you know, either due to hot temperatures, due to chilies, cause inflammation that changes the multiplication of cells in the mouth. And when this multiplication in the mucosal membrane changes, there is a certain trigger to the control of cells in the body. So instead of regulated cell death, some of these cells acquire sort of immortality, is what we'd say. So they are not removed, but they are deformed. They continue to multiply, they become dysplastic, and they turn out to be malignancies.
Okay. Frederick, let me come to you. And Dr. Carey, he has mentioned that there is more awareness. There is more people talking about cancer. Is that translating to people seeking or being tested earlier? Because I know one of the things that has been mentioned and has been proven is that early detection definitely helps much more than when you come later.
Yeah, early detection has a very important role to play in the management of cancer. I think, as what Dr. Kiaria said, in Kenya currently and most other developing countries, you will find that the incidence of having advanced cancers is higher as compared to those developed countries, like in the US, because they have been able to do a lot of awareness, and there are easy diagnostic tools that are available for people to know their status. So you'll find that in Kenya currently, majority, there's been that sustained awareness and also communication to the public about the risk factors of cancer and how to manage it. So most people know their health as how to go about it in the event diagnosis. How do you go to test? Like, let's say you want what are the trigger factors, risk factors? People know and own their health.
Okay.
So you find that if you encourage people to understand, and there's quite a number of awareness, like the Nairobi Hospital does free testing occasionally, just to engage the public to be able to understand the risk factors of today, probably in a particular month, we can talk about breast cancer, prostate cancer, oral cancer, and many other types of cancer.
Okay. Yeah. Dr. Kerry, coming back to oral cancer, what are some of the things one should look out for and possibly would be an indicator that one needs to be checked? Because things like mouth sores, you know, they come and go quite frequent, and once in a while you bite yourself as you're having a meal. So what are some of the things maybe one could look out for that would be an indicator?
Now, some of the oral cavity tumors present with sores, as you see. And sometimes the mucous membrane of the mouth has a very high replicative rate. Therefore, you're not, you know, you won't have a mouth sore that will be very prolonged. In a few days, it should resolve and go away. So some of the persisting ulcers, some of the ulcers that actually change and become nodular or they become a growth should actually be a warning sign. You know, if you get ulcerations that bleed a lot, if you get ulcerations that are associated with swelling of lymph nodes, somebody should actually be warned. And really, you know, we should be encouraged to look in our mouth as we brush our teeth, check what is bleeding, check what is paining, put a finger in gently and begin to feel, because also, you know, they are associated with this swelling, the ulceration, and also pain, and persistent. And some of the things probably may not be painful, but they can be picked when you go for your general medical exam, because they may be slow growing.
Okay.
Now, especially in smokers, people who chew tobacco, and also people who have certain infections can predispose you to oral cavity tumors. For example, human papillomavirus, you can get warts that transform to malignancies, you can get squamous cell malignancies in the mouth. People who have HIV disease can also be predisposed to certain oral cavity tumors. So certain subsets of our population who know they have an increased risk. You've been diagnosed with human papillomavirus in the oral cavity, then your doctor should have a more predisposition of looking around the mouth.
Okay.
And of course, Fred has said that we have increased awareness, but our population has not changed very much in the health-seeking behavior, and that needs to increase, whether it's because of stigma, whether it's because of myths and our traditions, whether it's because of lack of access and, you know, lack of financial, you know, support to be able to make a diagnosis. All that probably has to change so that we can pick up these cancers earlier.
Okay.
Yeah.
Frederick, one of the limiting factors, I believe, would be cost, and causes us to practice what I would call a poor man's medicine. And a poor man's medicine is where you go to hospital when things, you know, have really overcome you. You never go for regular checks. How affordable is a regular cancer check if one needed to do one?
Yeah, currently it depends with how somebody has been how somebody has been undertaking the regular checks. Sometimes you'll find that it depends where you go for the checks. Other people will just be taking some tests in those other not so much accredited hospitals, and you are told the diagnostic tests that have been done, they have not been validated well. If you attend to a good accredited hospital and you get to know your health, the burden of diagnosis and also treatment has tremendously reduced currently, because most people, I mean the public, has taken the insurance as a way of undertaking their medical cover, rather than just going down to their pockets and paying the cash. So with the advent of, let's say, the National Insurance Fund, the NHIF, majority of the people can now be able to access even CT scan, MRI, go take tests like even laboratory tests. These are simple tests that will be able to guide the clinician on the status of a patient.
Okay. Yeah. Dr. Kerry, as we're winding up, and possibly to all those who possibly smoke shisha and tobacco, what would your advice to them be?
I think it's what we call behavioral change. is that there are some cancers that we can't change. We were born with a genetic risk and we'll get them. And the best we can do is make an early diagnosis. But there are lifestyle changes that we can make. And 30 to 40% of malignancies are associated with things that we can be able to modify. So that is smoking. Cigarette smoking should be a no-no. Alcohol intake, use of certain chemicals through inhalation or through chewing that are thought to be social, or probably like the shisha we've talked about. You go to a social place, you're not very sure about what the constituents are. But those things should actually be discouraged because you don't want to have an added risk to probably already your genetic susceptibility. So as we also modify diet and have foods that are more prepared in a more natural form, we've read articles recently about preserved red meat and the risk of malignancies. So you find that there is a trend towards making food more natural, less preserved and fresh. That will also improve, or reduce your risk of malignancies. Exposure to sunlight and UV radiation, those are some of the other things that might reduce an individual's risk. Okay. And of course, if you have any discoloration, irritating, painful swelling around the mouth area, anything that bleeds, go to hospital quickly.
Be checked. All right. Yes. Frederick, your closing comments?
I'll urge the public to undertake the National Hospital Insurance Fund and also embrace other insurance policies for health. It is very important. And also I would like to inform the public, because we are from the Nairobi Hospital. The Nairobi Hospital has undertaken the National Health Insurance Fund, and majority of the public has that, there's that myth.
Facility.
Yeah, the myth also against the Nairobi Hospital is that the cost has been beyond the common mwananchi. So we want to inform them that healthcare is affordable, and they need to embrace the National Health Insurance Fund and also register in mass, and also to inform the public and their family members that once they undertake this insurance policy, the burden of cancer will be reduced.
Thank you very much, Dr. Gladwell Carey, who's a medical oncologist and a senior lecturer at University of Nairobi, and Mr. Frederick Asije, who is manager for Cancer Treatment Center. That's where we're going to wind up Morning Express this morning. So in case you had any doubts, you're planning to smoke shisha this weekend, you're doing it at your own risk. That's where we're going to call it a day. Have yourselves a wonderful day, but do stay with us right here on KTN News. Najma Ismail is ready to host you on World View. Do have yourselves a wonderful day. God bless.